Welcome to the Omega Studio News and Talk Show T. News you can use. Welcome to the Omega Studio News you can use. I'm your host, Kareem Clemons. Thank you so much for being here. Thank you so much for following me. Today is Sunday, March the 29th, 2020, and this is Sunday and Kobe Bryant Day. These are your stories. Okay, so I want to thank everybody for tuning in right here, right now, to all new Talk Show T and Omega Studio News. As we see, Kobe Bryant right here, right now. Let's go ahead and put my man up there. All right, got that. And let's go to Mumbo right there. All right, you guys, if you're watching, please like, share. I'm going to be showing you some data, some information coming from nextstrain and also from the Johns Hopkins, giving you guys the latest numbers on the coronavirus. And I want to say to everybody who is in self-quarantine and also in mandated quarantine, this will come to pass. Unfortunately, this is a terrible, terrible virus and disease that had cultivated the United States and also the globe, as well as many cities that are now popping up with more active cases as well as deaths. So I will do my best to show you guys the numbers, live numbers, the data, and then I will show you guys how and where it started and basically where it traveled from. I'll show it to you right here, right now, from statistics and data. All right, so right now I do want to go to, well, first of all, this is Kobe Bryant Day. So today makes 2 months, 3 days, 4 hours, 3 minutes, and seconds that Kobe Bryant passed away with his daughter and 7 other people in a helicopter crash in Calabasas on January 26, 2020. Kobe Bryant was 41 years old. Okay, we do know that Kobe Bryant was an American professional basketball player who played for the Los Angeles Lakers. Okay, the house that Kobe built. So right here we have inducted Kobe Bryant as Kobe Bryant Day because, again, unfortunately, his death was unexpected and it was very tragic. Okay, so please bear with me as I continue to spread the data on COVID-19. All right, so let's get into it. All right. First, I want to go to Johns Hopkins, which I believe this is very important because we need to follow the numbers, follow the data and statistics. Okay, right here, right now. All right, so right now, we are at 710,918 confirmed cases, okay, that are globally. And we can see that the United States is number one. The United States is number one at 135,499 cases. And if we go ahead and press on the United States, we can see that there are 2,610 in recovery, but we have seen that the numbers right here has raised to 2,381 in deaths. Okay. Again, this is the numbers from Johns Hopkins CSSE, which is the Coronavirus 19 Global Case for the Center for System Science of Engineer. Okay, and again, if I zoom into the United States, look how red it is. Like technically, majority of the eastern side of the United States is heavily contaminated. Okay, from the eastern, New York, Boston, Connecticut, to Florida, and then over here we see Seattle, and then California. So again, right here, we can see that the numbers have rocketed to 678 in deaths in New York. Then they have 171 deaths unassigned in New York. And they have Washington, 56 deaths in New Jersey. And it just continues to go on. People are continuing to lose their lives as we speak. Okay, and today is Sunday and Kobe Bryant Day. And at this time, I want to go ahead and say a prayer for all of us. And it's the Our Father prayer. Let us bow our heads. Our Father who art in heaven, hallowed be thy name, thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, which we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. For thine is the kingdom and the power and the glory forever and ever. Amen. That is a prayer from me to everybody in the globe who is suffering from, who is affected and affected by the COVID-19 or the coronavirus. COVID, coronavirus, D, disease, 19, 2019. Okay, so let's go back to Johns Hopkins and we can continue to see that these numbers are continuing to grow. But I do want to take you guys to this other system where I want to share with you and show you guys where and how this disease developed. Okay, so we're going to go to here. Now, bear with me. This is my first time doing this, and I went over the numbers. If you guys, are looking, watching, follow along with me, and I'll show you guys. All right. Okay. So we are now on what is called the nextstrain.org. And this is a map that definitely shows you guys and me on how and where this disease and virus happened. Okay, so I'm going to go ahead and zoom out, okay, globally. Okay, so right here we see that this is the whole globe, okay? And right now we're going to go to where it started, and that is China, right here, right now. So according to the statistics and data from nextstrain.org, we can see that the data started right here in the globe, we're going to look at December 7th, 2019. And as I continue to show you this, I'm going to go ahead and press play. And you guys will see right here how, well, we'll go over this, okay, as we speak. All right, so as of December 7th, 2019, we see the cases here in China. Let's press play. We continue to see that these numbers continue to go. It starts here, and then it goes down. Okay, so as of December 7th, 2019, we see the cases here in China. Let's press play. We continue to see that these numbers continue to go. It starts here, then somebody traveled to, looks like somebody is traveling to Shanghai, okay? And we're already at December 21st, okay? December 21st, then Christmas, okay? So we're at Christmas now, okay? Somebody is traveling from here, from Christmas, all the way to, so someone's traveled from here all the way to Shanghai. Now, again, we see no cases in the United States of America. It's right here. We're about to see our first host. Let's press play. So we see now by December the 31st, now we're coming into 2020. United States is still clear, okay? And then if we come over to the Northern Pacific, look how these numbers are continuing to go up. Now, when I say numbers, I want to go ahead and take you to this. Now, right now, so far, somebody from, let's see. So we zoom in here, right? Shanghai, this is so far how the virus is now spreading and in China. So they already have infected cases as of January the 2nd, 2020. We see that Wuhan right here, and then we see Singapore, Shanghai right here, and China. Someone is now traveling. Now, I'm not really sure if China has already seen that this was a disaster at some point to notify officials throughout the globe that they have now they have an epidemic over here. Because if you look here, and I'm looking just like you guys, we can see here, right? If we press it, did I just do something wrong? Okay, just, let me see this. Okay, China. What did I just do? Okay. Okay, so, oh boy, what did I just do? Okay. Okay, so now, oh boy, wait, hold on. Let me do this. I need to go back. Go back. Okay, we're at January now. All right, and hold on, let me reset this. We're over here. All right, so now someone is traveling from China all the way over to the United States. Okay, pause. Okay, now you guys see this. Somebody traveled across the North Pacific all the way to California as of 129. Okay, 129. Now, mind you guys, I'm sorry, 121. Somebody traveled over here to California, right? Then we press it again. Now we can see that now we can see that as of 220, hold on, let me just get this back to you guys. Okay, so we now see, come up here. Let me reset this. Then we will see now, and well, on February the 3rd, we now start seeing, matter of fact, let's rewind this back. Let's take this back over here to 125. Okay, 125. This is on January the 25th. Now, mind you guys, when I showed you guys the article on the OmegaStudioNews, I showed you guys that there was a post in the newspaper the next day on the 26th. This is 126. That's a Sunday. That's the day that Kobe Bryant passed away. In the article that I showed you guys, it showed the helicopter crash, and then there was a small piece of article on the left side of it, and it said that there were cases in China that was 1,500 and so, and the United States, it was about 100 and something cases. And I think that's where we come right here in Seattle, Washington, right? Then that article also continued to say that China officials was looking for a vaccination. And as you see right here, right now, it had already spread to United Kingdom, Denmark, Finland, Norway, Germany, Spain. That's why we see on the Johns Hopkins, the deaths are continuing to rise because now people are infected and don't even know it. And so they haven't started testing, okay? But check this out. They allow these people to cross over the Northern Pacific. They do not warn, or if anything, I'm not really sure if the government already knew. If they did, I'm sure they did, or somebody. We weren't even warned. The United States wasn't even warned. And we can start to see that cases is now popping up in Washington, San Francisco, California, Chicago, Maine, Wisconsin, Massachusetts, New York, Connecticut. Actually, nobody's in New York. That's Connecticut right there. So we don't have nobody in New York yet as of January the 26th, right? Now, we're going to go into February. Let's see how this map continues to play out. We are February 26th to 27th. January 26th, 27th, 28th, 29th, then the 30th. Now we in February. There is no social distance in place. There is nothing. We now continue to see that people are continuing to travel, and globally, when we now start seeing the numbers right here in China, especially in Shanghai, probably triple. And what I like about this, if you come up here, it shows you right here all the people, like the number of people in cases. I don't want to press on it because it might change it. And I want to show you guys what it looked like in February and also in where we at March. So this is beginning of February, right? Heavily populated in Washington, okay? We can see the numbers getting big, or the bubbles getting big. Now we on February 1st, 2nd, 3rd. Look, somebody traveled to Texas. The people are still traveling to Indiana, Washington. The people from Washington is traveling to these states. Boom, continue. So this is as of, okay, February 1st, 2nd, 3rd, and continuing. So okay, so let's move this over to here. And as of, I just want to just play it out so you guys can see it. All right, look at this. Now, I'm just going to do this manually. February 5th, then the 24th, the 27th, March 3rd, March 2nd. We already see now this globe is now heavily populated with the disease across the globe. Let's see this. And this is March the 3rd now, March the 2nd. And we can see right here, these numbers are, well, we can see the circles. And when you come up here, these circles explain who, where, when, how. All the red is Washington. I'm sorry, all the red is the United States and Washington, right? Washington State. Again, I apologize if this is not going the way you guys wanted to go. But again, this is my first time looking at this today, and I wanted to show you guys this because I think it's very important. If you guys want to go up there and look at it for yourself, the link is in the description box. Is nextstrain.org. Okay. And then when we zoom in, we will see. Let me continue to do this manually. Look how we are now all the way up to the 25th, and then come to today's date, the 29th. It is crazy. We've seen the map on the Johns Hopkins. Now we're looking at this here. And also, too, you guys, this not only gives you data on the coronavirus, but it gives you data on other diseases like Ebola, right? The flu, the measles, the mumps, TB, Zika. And then also, too, what I like about this, if you come up in here and you press one of these, it gives you it was giving you the age of the person, a male or female. You can see right here is the host. You can see here, right? These are all the labs. These are the labs that were doing testing, and they definitely showed, who was testing positive. And then we just started to see the death toll rise throughout our great country and also across the globe, throughout our continents, right? So again, if you guys want to go up on here and you guys want to look at this and y'all want to take a look at the different type of data that is on here, like the flu gives you data on the flu, but this is going all the way back to 2014, if we can see it, okay? And it just breaks down, everything for you, right? You can do seasonal, what type of strain. And also, too, they were saying that the coronavirus has 8 different strains when it comes to the coronavirus, right? Because a lot of people are getting sick and they have to determine where this, what type of strain that a person has, right? So again, we continue to see the numbers from this data right here. And we can see it's very alarming, it's very scary. And again, I guess that's why, not I guess, but this is why we're practicing social distancing and staying away from people so we can get it under control and get back to our everyday living. And that is going out in society and living our best life, right? So again, I wanted to take you guys over here to this data and statistic map to show you guys uh, what's happening across the globe. And I think it's very important that we see this and that we follow it, okay? Because we have loved ones that are all across the world and across the country, and we want to protect them and we want to inform them and keep them up to date on information that is dealing with this deadly, deadly disease. I think it's very important. Hello, how you doing? How you guys doing? Yep. Good afternoon. Hello. Daquan Jones. You're on lockdown in Long Beach. Unbelievable. Everybody's on lockdown. It's like a ghost town, like nothing is open. Wow. Unbelievable. Al Nicholson, what's going on? Okay, so again, this is Sunday and Kobe Bryant Day, where we celebrate the life and legacy and remember Kobe Bryant. And also it's Sunday, but also, again, we are dealing with this disease, which is coronavirus 2019. All right. So if you guys want to go to this data, you guys can go to www.nextstrain.org and you can follow all the statistics and data on the coronavirus as well as data on other deadly diseases, which you can see over here. Okay? All right. Okay, so first of all, I do want to say thank you guys who tuned into my video this morning. Like I said, somebody in my building must have test positive, have test positive. I don't know. I just know that I cannot leave the apartment. Okay, I cannot leave. I just know when I went downstairs this morning, about 9 o'clock this morning, they had EMS, police, fire, hazmat suits, hazmat team, and they told me that I cannot wash my clothes. Nobody cannot leave their apartment. They have police officers standing outside the door by the elevator, ordering people they cannot leave until further notice. So again, I've been eating potato chips. I've been eating. I haven't even eaten breakfast. I don't have any food because I can't go out and get any food because this is going on. So I'm not really sure if they're going to each individual apartments and they're going to knock on their door and say, listen, we got to test you. I don't know what's going on, but right now we are either doing self-quarantine or mandated quarantine, or we just can't leave. That is the case right now. And also, I do want to say that I still have that shirt because, like I told you guys, when I went downstairs on yesterday, I went downstairs to the laundry room and it was like really packed with a lot of people. And then uh, I opened up the door with my shirt, and then I opened up the door going out with my shirt, and then I came up and I realized that the same shirt was in my clothes, and I was going to wash it today, and then I realized that, so I had to separate it and put it in another bag, and I wanted to get rid of it, but unfortunately, I can't do that because I cannot leave. So I've been here, and hopefully they'll let us, do something. Let us go outside, get something to eat or something, because I can't continue to eat chips. They're almost gone, and drink water. So I have here, and I need to get some food. You feel me? Like my stomach is growling. I need to eat. So I'm sure I'll be able to work something out. I do have some cake that I had made on yesterday, but unfortunately, I can't just eat cake. I have to eat, food. So again, this is Sunday, Kobe Bryant Day, and also Sunday. Okay, and at this time, I'm gonna see if I can try to do something new here, where if anything, yeah, no, right. All right, so shout out to everybody who's here. And if you guys want to leave a comment, you guys can leave a comment on in the box. Uh, keep it cute, like I always say, because it's going to be posted up here. And I'm trying to see if I can get like inviting, like get some people up here and talk on the show, and you guys can just talk about your quarantine and what you're doing and how you're doing it and how are you taking all this in. Plus, also, I do know that again, we know that the President of the United States had gave a 15-day quarantine measure for the United States, and that 15-day is up on it's up on the 31st, the 30th, the 31st. That's tomorrow, Monday. Okay, so I'm not really sure what's going to happen next after that, but let's go to social media to see what are they saying on the lift up from the president. See, now look at this article. Now, I just showed you guys the strain map. Now, there's an article right here that's saying that the U.S. failed to test, let the virus spread undetected for weeks. Now, let's see what they're saying when they bring this article up. Okay, so and that's what I was saying. Like when I went and showed you guys that statistics. Right in December of 2019, we see in China that their cases become very, very large. And then someone traveled in December all the way over to Washington. So again, I'm not really sure if if China knew about this already and that they did not warn an issue to the United States, or if they did issue a warning to the United States, or were they checking people at their border when they were letting people travel? You understand? Because we already seen a significant case over there in China. And then we seen in January someone travel over to Washington. And then that's when we start to see the cases getting bigger in January 1st, 2nd, 3rd, 4th, 5th. And then by the 26th, we've seen that the cases over in the United States was getting very, very robust, right? So again, my thing is, did the United States know about this and didn't say anything to anybody because they thought that this probably wasn't going to be a scare like it is happening right here, right now? So according to this article, let's go to this article, okay? Because this is my first time seeing this article, okay? This article is saying that how a failure to test blind in the United States COVID-19, okay? But we seen earlier that it said, well, I seen that it said U.S. failed to test, let virus spread undetected for weeks. But anyway, let's see. Okay, so according to this, it says early on, dozen federal officials changed for defining the United States, America against the COVID this great day after the White House situation. Okay, the members of COVID task force typically devoted only 5 to 10 minutes. But as the deadly virus spread from China, right, to the United States between late January and early March, the large-scale testing for people who might have been infected and did not happen because of technical flaws, regulation hurdles, business unusual, verification for lack of leadership at multiple levels. So again, when someone traveled over to the United States, I'm not really sure if they knew about this from the health department or the CDC, because once they seen that vast majority of cases in Washington, they should have notified the CDC like that, like completely like that. Okay, so again, did the United States know about this? And if they did, who is responsible for notifying? And if anything, did they do anything about this. Like, I think that there needs to be a conspiracy report, just like how when September 11th happened, and they wanted to know at the level of what the Federal Bureau of Investigation, the government knew. I think right when this is all over, we should start seeing seeing who knew about this. Uh, did anybody say anything about this? Who's responsible? Because somebody's responsible for this. Okay, even though it is a virus that we can't see, and it's deliberately through the germs and stuff. But I'm saying that the officials have known about this for some time. Okay, and the question is, could they have alerted someone to say something to the general public? Or if someone just let this fly by and just say, listen, we don't really think that the cases is going to get real serious. But again, when we seen on the strain map, we seen that those numbers were getting big from February, January 26th, 27th, and the 30th, all the way until February. And then once when February happened, that's when we start seeing a whole bunch of cases in the United States and Washington itself. And then people started to travel and go other places because they had it and didn't even know it. So again, here it says, again, did the United States know about this? Okay, did they know about this? And if they know about this, why they did not warn the United States? And why did they just now warn the United States in March, the beginning of this month? Which it's too late now because people are now succumbing to this deadly virus and they're now infected and affected by this. And according to here, let's go here. This is something where they're saying that they're saying now that 200,000 people could die in the United States. So this is the guy from who is the let's see, click here to read the full article. Okay, so we're gonna go, matter of fact, let's stay on this article here. And it definitely says here that, okay, no, actually I gotta go to this one. Terminate that one and go here. Yo, my stomach is growling. I'm so sorry if you guys can hear that, but yo, I'm hungry and I need to eat. All right, so right here saying that Trump boasts of the coronavirus TV rating that 200,000 people could die in the United States. So President Trump posted TV ratings Sunday, while the doctor of the White House Corona Task Force warned that up to 200,000 Americans can die from COVID-19. I don't, what the hell is he praising viewers for? Who cares about the views? We want to know what the United States is doing to vaccinate people. If they come up with something, we have all the money in the world, and we cannot come up with something that's going to help Americans who are affected and infected by this. Unbelievable. There's just so much news about the coronavirus on here. And again, they're saying that at least 200,000 Americans can die from COVID-19. Very sad. Very sad. Very sad. Right? So, again, if you just joined in, this is the OmegaStudioNews Social T. Happy Sunday to everybody. This is Kobe Bryant Day. And again, I wanted to show you guys some information from the different strains on coronavirus, as well as Johns Hopkins data information that's showing where the infections are happening, who's recovering from this, and who's dying from this. And we've seen that the numbers are very, very high when it comes to the United States of America. We are number one on the list. Okay, and I know that people are sick and tired of hearing about this, but right now, this is our reality. This is our reality right now. We're not doing anything but uh, we're forced to be in our homes, either mandated uh, voluntarily or just we're here. Like I can't go anywhere because there is some stuff going on out there. Okay, so and again, this is not going to be a long video. This is just a short video for this segment on today because again, I don't really have energy uh, in me to continue because I have to eat and I can't continue to eat junk food if I can't go outside and get something to eat. I'm starving. Like seriously, I'm hungry. And I don't even think they even know that the fact that there are people who want to go out and get essential things, and I'm one of them. So, I'm just eating chips. I made carrot cake yesterday. I cleaned up like 100 times. I did a lot of stuff, man. Like I to keep busy. A lot of people do stuff. I play, GTA 5 and all my games and everything. So, everybody's doing what they do, and then at some point, it's going to get boring. Like people want to go out, they want to exercise, they want to get back to their daily life, especially they want to get back to work. But unfortunately, some people unfortunately lost their jobs because of this disease. But again, we do know that the stimulus check has been passed, $2 trillion. Well, 6 trillion, and that money should be in the accounts. They saying within 2 to 3 weeks. Okay, and then we do know that there are jobs available, but nobody's not going to want to go to those jobs because again, nobody's not going to want to work because they feel that they may be infected by the disease. So there are jobs that are available. Okay, and again, to those companies who lost their, who laid off their employees, part of this bill was to help them to get money if they kept their employees on, but unfortunately they laid them off. So again, some companies, people will not be entitled to this because they make over a certain amount of money, or as the more money you make, the less of much money you receive. But people who are unemployed on unemployment, favor for them is that they will not only receive their unemployment check, but according to what statistics are saying from Social Media Network, they're saying that they will also get on top 3 to 4 months of extra payment, which I'm not saying if that's helpful. For some people, it is. Some people, it's not because it doesn't add up to their expenses, and their people have rent that is due on the first. People have bills that are due, credit card, mortgages, rent. All that stuff is due, coming up. And I did hear that, and I read some posts that some places was going to suspend rent for the next 90 days, or they're not going to evict people. They're going to hold out on the payments on different bills and stuff. It's just a setback for a lot of people. And from the Omega Student News and Social T, I do want to applaud everybody for adhering to the rules and regulations and keeping yourself and your family safe from the disease. Again, I will just continue to stress this, that everybody should continue to practice the social distancing, stay away from people, because again, we don't know who's carrying the disease. Unfortunately, it has to be that way. Continue to sanitize, continue to wash your hands correctly, continue to cough or in a napkin, continue to do that. and continue to clean down your surfaces. Again, the coronavirus is not airborne, so you don't not necessarily have to wear a mask every time you go outside. And I gave you guys the scoop on a mask, wearing a mask. Uh, the surgical mask is not made for someone wearing a mask for 24 hours because, again, that mask gets dampered and it gets wet and moist, and then it's giving the virus, if anything, like if anybody's coughing or if you touch your mask or you touch something and it's there, now you're putting yourself at risk. And you should only wear the mask is if you're developing symptoms of a flu or cough. But if anything, just stay home if you are suffering or experiencing flu-like symptoms, or contact your health provider or go to the nearest hospital. Well, I wouldn't say go to the nearest hospital because, unfortunately, the hospitals are packed with other patients that are dealing with COVID. So I'm not really sure how they're going to handle uh, regular patients compared to people who are suffering. So my thing is that if you're suffering from flu-like symptoms, again, like I said this morning, when I woke up this morning, I had diarrhea, but it wasn't from the it's not from the COVID because I'm not experiencing other symptoms like um, respiratory or aching chills. I'm not experiencing that. So with that being said, I don't think I have it. But in the same way, if they are out there and they're saying that it's there and somebody may have it, then I may have to get a test. You understand? And again, it's like the world we're living in, right? The world we're living in. Okay, so all right. So with that being said, like I said, this is not going to be uh, a long video. This is just going to be a video that is talking about the uh, the nextstrain and also from John Hopkins on the COVID-19. Okay, so again, I want to thank you guys for tuning in to this video. And again, if you have any comments or if you have any suggestions, let me know. Send me a comment again. It's like I'm trying to have the energy to, continue to, you know, uh, go on. But a brother got to eat, man. I got to eat. Seriously. So I'm sticking with water. Got chips. I got cake. So, but it is what it is, right? So again, this is Sunday, Kobe Bryant Day, and also the OmegaStudioNews Talk Show T. I'll give you guys information. For more information, you guys can visit the blog page. Okay, thank you guys for watching, and I'll see you guys on the next stream. Bye. That's all right.
You say you wanna try, but but you never do. Sugar, there's a reason why we lose. You say you wanna cry, but you never do. Sugar, there's a reason why we lose.